Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Nick Circle, and I'm so excited to be here as always. And thank you again for tuning in. Please don't forget to subscribe, leave a comment, and share it with your friends. Last week we talked about an encourager. The week before that, we talked about self-reliance, and the week before that, we talked about self-absorbed. Well, today I'm going to be talking about how to choose the right doctor, more specifically on how to choose a chiropractor. Now, there are certain questions you want to ask before you go into the office. I will tell you something though, a little hint. If you get bad service over the phone, you're probably going to get bad service at the office. And that goes for anything, whether it be a service of any type, medical, even getting your car done. If the people on the phone aren't nice to you, they're probably going to be different when you get there. It's very important. That's your first line of defense. In my office, it is my first line of defense, and I'm very, very, very proud of the ladies that work with me. They do an excellent job at talking to my patients in the office and outside the office. So that's number one. You want to look and see how they treat you on the phone. The second thing you want to know is, what are their credentials? Really? Okay, they're doctors, we know that, but what else is there? Do they have advanced studies in something? Do they have fellowships? What a fellowship is basically after you finish medical school or chiropractic school, dental school, or any other professional school, it's a fellowship in which you've taken a next step in your studies to get a board certification. What that means is you have to take a national exam to be board certified. In chiropractic, we have them as well. A lot of people have seen chiropractors and they go, I didn't even know they had that. There's 6 of them. There is radiology, neurology, sports medicine, rehabilitation, pediatrics, and orthopedics. I personally have a fellowship in orthopedics. I went to school for another 3.5 years, and I ended up getting a national board certification once I passed that test. So when you call and does Dr. Circolone do this? Most of the time the answer is yes, because with my orthopedic fellowship, I have more advanced training and we can do more things. That to be said, musculoskeletal is what I deal with. I am a non-surgical orthopedist. I don't do surgery. The only time I am in OR is when I do manipulations under anesthesia. I have a certification in doing manipulations under anesthesia. That is the only time that I go into an OR. We don't do surgeries, but what we try to do is get people from having surgery. And we get a lot of referrals from other physicians going, you know what, go see Dr. Circolone, see what he can do. Sometimes he can prevent or even prolong having surgery. So those are the things that you want to ask. The other thing is do you commonly treat my condition? That's important. You want to go to a doctor that treats your specific condition. Have they seen this before? Have they done this before? Do they know, hey, if this doesn't work, I know what else I need to do. So it is so important that they not only treat your condition, but they've treated it more than 1 or 2 times. Another thing I get asked all the time is, do I need to have x-rays when I come into your office? The answer to that question is, not every time. Some people come into the office and we examine them, do a thorough examination, and we do a thorough history, and we find that their problem may be more of a muscular problem more so than a skeletal problem. And what we will do is we will treat that patient conservatively for several visits. By treating a patient conservatively, we get to see if they respond. If they don't respond within a relatively short time, 1 to 2 visits, what we do then is we send them for x-rays. I do not do x-rays in my office. A lot of chiropractors take x-rays in their office. I personally don't do that for 2 reasons. Number one, insurance companies pay when you send it out to a facility. Number 2, and the most important thing is, I get excellent films And I have a radiologist that reads that along with me so we can have a discussion and find out if there's something that we're missing or something else that we need to do. Sometimes x-rays beget. I call it, it's going to beget this. If an x-ray is taken, we're treating and we treat a little bit longer and they don't respond, we need to go to the next step, which is a CAT scan or an MRI. A quick little side note, I did a story on cervical radiculopathies and cervical pain where I talked about using a pneumatic collar. If you want to check out that video, please look at it. It's on my channel. And I talked about Joe Rogan going to his chiropractor. Joe Rogan does not like chiropractors because he had a bad experience. Now, does that mean all chiropractors are like that? Of course not. But in his case, he went to the chiropractor, I'm assuming he took x-rays, treated him for about a year, and never got advanced studies. Well, Joe turned around and goes, I'm not getting any better. So he goes to his family doctor or another type of doctor, and they find out that he had a bulging disc in his neck, which was causing all of his problems. That's important. If you're going to see the chiropractor and you're going and going and going and going and going and going and not getting better, and they're not doing anything else to help find out what's going on, you need to find someone else. That doesn't mean all chiropractors are bad. What that means is you need to find another chiropractor that does the things that you need to have them do. That to be said, that answers the question, can a chiropractor help me? The answer to that is most times yes, if it's a musculoskeletal problem. If you're going to go in there and you need stitches, well, that's not going to happen. As long as they're musculoskeletal conditions, that's where the chiropractor shines, and that's where you want to get the best one you possibly can. Again, we talked about prolonging treatment. That's another question you need to ask. How long am I going to have to see you? Am I going to have to see you 3 times a week for a year? Am I going to have to see you 3 times a week for 2 years? Am I going to have to see you 3 times a week for a month? It all depends on patients' conditions. Let me tell you this. You should be getting well quicker. If you're not making progress, then you need to go another route, and your chiropractor needs to be the one that sends you to that other physician or to get other testing or modalities or something else. Personally, when a patient comes in the office and I see that they've reached kind of a maximum medical improvement, but I know that there's more that they need, what I'm going to do is send them to a physical therapist to help get them stronger, and that usually does the trick. Now, do we send to orthopedists? Do we send to their family doctors? Of course we do. That's the kind of doctor you want. You want a doctor that works with other healthcare providers in order for them to get you better. I can't tell you how many doctors live in this small box and don't want to send patients other places. The other thing is, and this is kind of a personal thing, stop looking at the internet and trying to find these guys that are snap, crackling, popping, and doing all these fancy things with the Y-strap, the towel around your neck. That's not what everybody needs. I know it looks fun, it sounds great when you hear that popping, but that doesn't necessarily mean it's getting the patients better. You want someone who's going to treat you for what you have. Everybody that comes into my office does not get the same treatment. It's always different. I will say this. Chiropractic manipulation, there's not much you can change with that. There's different techniques, but you don't want to do the same thing on the patient every single time that they come into the office. And I've seen that happen. There's times when you'll go into the doctor's office, he will do the same thing every time you go there and do the same thing to every patient that's before you or after you. That's not the doctor you want to go to. You want to go to a doctor that's constantly changing your treatment because you're dynamic, you're changing. You're hopefully going from bad to better, not from bad to worse. So these are things that you can do and think about and ask and find out if this is going to be the place that you want to go to. If you like your chiropractor that you're going to, if you're having good success, stay with them. If you're not, try to find another one and ask some of these questions. The thing is, ask questions. You are a consumer. You are looking for a service. So what you want to do is you want to find the best person to give you the service that you're looking for. Guys, I love you. I hope you have a great week. God bless, and we'll see you soon.